Medical Intuitive Insights with your host, Dr. Gloria Warren, is a program that presents topics on medical intuition, holistic opportunities outside of mainstream society, and scientific research as applied today. Topics range from online intuitive readings to interviews unveiling alternative healing modalities and discussing them with inspirational leaders. Dr. Warren is the bridge within holistic arts while stressing the balance between the spiritual and physical self. So now, please welcome the host of Medical Intuitive Insights, Dr. Gloria Warren.
Can some medications be safely reduced without sacrificing mental stability? How does a psychiatrist determine when and how quickly to lower a dose? What is the difference between withdrawal, relapse, and the return of an underlying condition? Welcome to our show. This is Medical Intuitive Insights. I'm your host, Dr. Gloria Warren, epidemiologist, and on and on and on. The terminology distinction means a lot, so it may help during the program. Let me just state these three definitions so we understand them as we move along. Titration is adjusting a dose upward or downward to find the safest and most effective level for the patient. Tapering is gradually reducing a medication to limit withdrawal symptoms or clinical destabilization. Deprescribing is a supervised process of reviewing, reducing, or discontinuing medications when their risks or burdens may outweigh the current benefits. Please remember, this show is not meant to replace your medical practitioners. It is just for educational purposes. You can take some of this information to your physician or your nurse practitioner or whatever medical practitioner of your choice is, okay? So let's look at why consider reducing medication. But first, please welcome to our show, Dr. Akhter. I'm sorry, Aafaque Akhter. I'll get that right. I know I will. Dr. Akhter, please tell the audience what you're certified in so they get an idea of your background.
My name is Aafaque Akhter. I'm board certified in psychiatry and addiction, and currently I practice in an inpatient facility, Bedrock Recovery Center in Kent. And I supervise a lot of nurse practitioners in outpatient and other programs in psychiatry in Massachusetts.
So you are the man to definitely speak with regarding this topic. I was very pleased that you were very warming and welcoming to be on the show today. And this is a good show. Everyone's going to want to stick around for this information because I feel that prescribing medications is more of an epidemic in itself. And Dr. Akhter will help us get a grip on what we're talking about here and what they can talk to their doctors even about. So why medication reduction is considered? Why would you say it would be considered at some point?
So I'm a psychiatrist, but in general, medications are meant to have temporary relief. So I think that it is important for me. I want to convey this message to all that any medication you are taking for more than 6 to 8 hours, you should look into, can you do something that some alternate treatment or alternate lifestyle change that you don't have to take medicine. It is meant for a temporary relief. For example, one of the medicine in general practice is epidemic is the medicine for heartburn. Like almost half of the world is on that medicine. But that meant for only 4 to 6 weeks use. Somebody has a stressful situation, ate some spicy food, having to work late, eat late, sleep early, whatever it is. take the medicine for a brief period and then you stop. But what is happening that now people are keep taking it and taking it year after year after year.
Mhm.
And that develops a situation that you cannot live without that medicine. So that means you, in a psychiatry term or addiction term, you are addicted to it. You can't get off it. Just even the
Mhm.
heartburn medicine. You have reflex acid, and just you can't get off it. Two of my siblings are addicted to it. They can't get off it. And it has a tremendous side effect. One of the most
Mhm.
prescribed and lethal drug for chronic purposes. So for all who is taking this medicine, look into it. What else can you do to get off this medicine? It has to be slow and you get off. Similarly, suppose somebody has diabetes. There are other ways you can cure diabetes. So any medical or psychiatric illness, right, you always look into how can you reduce your medication need and how can you get out of it if it's possible. In psychiatry, these are very strong mind altering drugs. And to larger extent, we don't know how it works. But whatever the theoretical aspect or presumptive aspect we have in psychiatry, the one thing we know that in order for the medication to start working, it takes 4 to 6 weeks to just start work. So any psychiatric medication you take, first 4 to 6 weeks, you don't see any effect, you see the side effect.
Mhm.
And the effect comes. So I have a different way. I try to explain to people I supervise. Suppose you are in an inpatient doc. Somebody comes psychotic or manic, right?
Yeah.
You use a higher dose of medication and give some medication to sedate the person. So you use the higher dose of medication to sedate the person, not to have psychosis resolved.
Mhm.
Sedate is important in inpatient psychiatry because people who have mania or psychosis or severe depression or severe PTSD, they tend not to sleep. When you don't sleep, your brain doesn't detox. So the first
Right.
goal for me that when they come to inpatient, I give them few days of good sleep. And I use the medication side effect to achieve that. But I would not continue the same dose before discharge. My goal would be when the patient's medication starts working, then I will slowly get to a level that it is tolerable and it is effective. Now, is there a science behind it? No, it is experience. And
Right.
unfortunately, most experienced psychiatrists don't practice because of the insurance issue, payment issue. Probably you don't know, Gloria, or our listeners don't know. Medicine is dictated by insurance payment, and
Mhm.
in payment is dictated by a call a CPT code. So suppose I have a 22, 23, 25, 28-year old resident who just graduated from medical school and residency. If he bills, he gets the same payment than person like me who has 30 years experience.
Mhm.
If you go to the lawyer's office, the junior lawyer charges $200 an hour. The senior lawyer charges $1,000 an hour. But it's not the situation in medicine, in psychiatry. So how much experience do you have? You get the same payment. So once you grow older, you have no incentive to practice. So that's another issue. So I want to stick to our topic that
Mhm.
it's important to reduce medication. As I said, in the beginning, we just keep giving the medicine and use its side effect because most of the psychiatric medication cause sedation. So we sedate the patient. But when the sedation, the goal of sedation ends, then we start looking into the effect. If the effect happens, then we slowly reduce it. In
Mhm.
out, we do differently because we don't have the control on the patient. We don't see them
Right.
every day. So what we do that we start very lowest dose approved by FDA, then very slowly increase to get the effect. Because I don't want them to have a side effect very early that they stop taking medication. So
Yeah.
when we reach to a place when the medication is effective, but after a few months, I have to think maybe after 3 to 6 months, the medication is could be reduced because we don't know how it works. So
Right.
as 6 weeks it didn't work, the next 6 weeks it worked, and the next 6 weeks it will work even better. So probably at this point I can get away with a smaller dose. So I like to give chance to every patient that we reduce the dose, keep monitoring it. The problem issue
Mhm.
here is the monitoring. We
Yeah.
cannot monitor enough. So a lot of people just leave it that aren't broken, don't fix it. But my approach is that every patient deserves the chance. So suppose I give you example. Somebody had a bad situation at home, bad situation at work, had a car accident with enormous stress, not sleeping for several days, become psychotic, comes
Mhm.
to a hospital. We call it nervous breakdown, or I call it psychotic. They come to the hospital. We treated them, they got better. We discharged them on an XYZ antipsychotic. But I have to be mindful that this patient may not need lifelong treatment. Just
Right.
it was a situational psychosis or adjustment disorder. She got psychotic. She came to us. We treated, but somebody has to give in 3 to 6 months stop or reduce the medication slowly, observe and see if she can do or he can do without the medication. Because any medication you take, you have side effects. There is
Right.
not a single medication which doesn't have side effects. You take Tylenol, it can damage your liver. You take Motrin, it can damage your kidneys. In fact, having uh, ibuprofen over the counter, Motrin over the counter, causes more renal failure than any other.
Mhm.
So any medication gives side effects. And some of them we know, some of them we don't. So as a
Mhm.
physician, we see do no harm. It is our duty to look into how we can reduce medication or eventually stop medication. Some people we may not be able to stop medication, but I would like to give them the smallest dose which causes the least side effect. That's why it is necessary to look into reducing them.
I think that's very responsible of you, actually, as a physician. As you said, it's your responsibility to not do harm. It's just
Yes.
interesting because I was on the clinical study in the pharmaceutical companies. I was on the clinical study for proton pump inhibitors. So that's interesting that you caught that up. And we were doing the long-term study at one point, and we found that a lot of patients on that long term, more than 2 years, it was defined, ended up with heart failure. Just a thought, just a thought. I'm not telling people what to do, but I do believe short term for everything. We are going to take a commercial break. But when we come back, titration and individualized reduction plan. You won't want to miss this. We'll be right back.
Mike Zoric, a three-time California state champion in Greco-Roman wrestling at 114 pounds. Mike, blind since birth, was born in Hartford, Connecticut. He was a six-time national placer, including 2 seconds, 2/3, and 2/4. He also won the Veterans Folk-Style Wrestling twice at 152 pounds. In all these tournaments, he was the only blind competitor. Nancy Zorick, a creative spirit whose talents have taken her to the stage and into galleries and exhibitions in several states. Her father, a commercial artist who shared his instruments with his daughter and helped her fine-tune her natural abilities, influenced her decision to follow in his footsteps. Ms. Zorick has enjoyed a fruitful career doing what she loves. Listen Saturday mornings at 12 Eastern for the Nancy and Mike Show for heartwarming stories and interesting talk.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of The Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on The Caring Generation and PamelaDWilson.com.
Welcome back to Medical Intuitive Insights with Dr. Akhter. We have been discussing considerations for reducing medication safely through titration, support, and medical supervision. Now, Dr. Akhter, what tells you that a patient may be ready to consider a lower dose?
Patient wouldn't tell you that they
Right.
are ready or not ready. As a physician, we have to think that these are very strong mind altering drugs we are giving them. Is it necessary or is not necessary? Because at the end of the day, at some point, we have to think we all can function without medication. We should always consider we can survive without medication. Medications are there for a temporary relief. In modern science, there are three different branches of medicine, if you think about it. One is the surgical medicine, another is the emergency medicine, and the third one is the general medicine. The two of them work fantastically, surgical discipline and emergency medicine. But I think the taking medication for chronic illnesses, we need to think about. I think we are over medicated. We're taking too many unnecessary medicine. Rather than fixing the food, we are trying to take drugs. So suppose you have awful food, bread. You eat bread. Eating bread is not bad, but your wheat is not properly made. Your food is genetically modified or crossbred or put a lot of fertilizers. Rather than 9 months, you can get a crop in 3 months. So our food is not good. So then we eat a lot of food because food is not whole food. And then we get sick. Then we go to the doctor, we take medicine. Then it has side effect. They take more medicine and then more medicine, and this becomes a cycle. At some point, we have to think how we can reduce our medication dependence.
Mm-hmm. Yeah, I fully agree with you on that topic. It's, our food has a big problem here in the States. And, back to one of my other shows, I called it fake food. I didn't mean to call it fake food. It is alternative foods. It's manufactured foods.
Yeah.
But these foods they're not enriched with vitamins and enzymes and things that your body needs from holistic foods.
Yep.
So my general approach to my body is I eat as medicine. And when I eat, I make sure that I do a quick check. Well, what do I need today? And then I know what to eat. It's not like, oh, I really want a steak right now, or I really just want a bowl of cereal or something. I try to only eat what I know my body needs as medicine to stay healthy, if anything else.
Yeah.
So I believe we did talk about your approach to titration. and developing individualized plans based on just the human person themselves. Everybody is different, and you can do it one of two ways. It's what I got out of that conversation. You can put them on the highest dose because you're limited to time constraints. You put them on the highest dose, and then you bring down that dose, but there's a lot of side effects doing that. Or if you have the time, you're allowed to, you could just start building it up and slowly increasing the dose, a little less risk and adverse events. But it all is based on what the insurance will pay, and it's not your choice always. So you try to do your best with what time frame you have, and adjusting over time. You mentioned that as well. Sometimes after 6 months, you need to be reevaluated. Do you really want to be on the medications that alter your mind to that degree for years and years and years? You end up with more kidney problems and liver problems, depending. I think a lot of times it's between the kidney and the liver, or it could be both, or it could be other parts of the body that it actually
Also, it affects
harms.
the social life.
Right.
That makes people lethargic, have no emotion.
Mm-hmm.
So we have to consider how can we provide this human being a reasonable life on the medication or without the medication. Okay,
Right.
not everybody can be without medication as far as the mental illness is concerned. Some serious mental illnesses probably needs medication, but how much? To a limit that they are like a zombie. So
Right.
this is a problem, and it really affects my. I always think about it. How can we give these individual a reasonable life that they can smile, they can go to the restaurant, they can go to their families, and people don't notice them that they have a mental illness. So
Mm-hmm.
the other aspect, as I talked about the neurotic and psychotic illnesses, some of the neurotic illnesses like depression, anxiety, I think they're situational. For a temporary phase, if somebody is, suppose a kid going to college first time, gets depressed, right? It maybe they get depressed, they get anxious. For a brief period, they took some anxiety medicine. But that doesn't mean that this patient suffers from anxiety disorder and rest of their life they have to take medication. So once the crisis is over, I need to take this medication off of the patient to see or let his body heal and learn to cope under a stressful situation.
Yeah.
But this is lacking right now. This is the biggest lack we have, that people are not thinking to reduce medication. The other problem I see in clinical practice, that people have tendency to increase dose too fast as an outpatient. So you came to me, or somebody came to me who has a depression. I think, okay, the patient needs Prozac. I gave 10 milligram of Prozac. I'm seeing him in 2 weeks. Oh, I make it 20. You don't have to. Just have to educate the patient that it takes 6 to 8 weeks before you see any effect.
Mm-hmm.
Until just stay put. Or if you have anxiety, I'll give you some anxiety medicine. Then when anxiety is over, 6 weeks is over, and you have little benefit but not full benefit, I might increase it. But this timeline, nobody wants to wait.
Right.
Neither the patient nor the doctor. The second issue comes the insurance payment. Okay, you saw the patient, but what did you do? He didn't do anything, so I'm not going to pay you. So
Mm-hmm.
these all factors has created, as you said, the epidemic of prescription.
Yeah. They want it here and now too. They want the effect to be right there. They want to wake up the next day and it's working. But
Yeah,
psychiatric medications do not normally work that way.
or
It's
even the traditional medication. I'm from India, so I believe in a lot of things. Suppose the study shows that if you do yoga
mm-hmm.
consistently, it brings down your blood pressure, your anxiety, but it takes time. We
Yeah.
don't have the patience, or we don't want to fix our food. We still keep eating salt, so that our blood pressure is up. Eating carbs, our blood sugar is high. Eating too many times, so our insulin is high all the time. So it fails eventually. So I think that our bodies haven't grown genetically to a level the food is available. And I think this is a transition phase. That phase can go for 1,000 years, but our genetics is not supporting this kind of food right now. That's why the majority people are on medication.
Right.
And
It's interesting, the social effect of
yes,
that.
and the
Yeah.
society has become too disintegrated. So that's why you see the epidemic of mental illness. And if you have seen the number of patients with depression, anxiety, psychosis, mania have increased after the COVID closed down, because
Hmm.
we are social animals. We need people. So we were locked up in a room, and then people went crazy. And after that, a lot of people have mental illness. Now the new hospitals are built, but we can't train enough people. The number of clients need help. We don't have that many psychiatrists or nurse practitioners, trained nurse practitioners.
Right. And I think, you know, also the other things that get involved there is alcohol and cannabis and substance abuse. That's all these other factors you need to take. You have one heck of a job. That's all I have to say. You have a job that is very unique and extreme. So sometimes I think we need to, applaud all of our psychiatrists that are trying to do the best for the patient. I mean, there are some good and bad doctors of all different types, and that doesn't escape the psychiatry field. But when you find a good doctor, that's why you're here. That's why I wanted you to come on today, because what you deal with on a day-to-day basis and all these other factors involved, it's not just a patient on psychiatric meds. They could be a drug abuser, maybe on pain pills, or an alcoholic, and all of these other factors come into that equation. And then you become a juggler, so to speak, a professional
Yeah,
juggler, but
yeah,
you're actually very um, synchronized and zooming in and figuring out exactly, let's try this first, let's try that, let's get rid of this, let's get rid of that. It just amazes me.
yeah.
It's
And
such a
it's time
field.
consuming job. The psychiatrist's job is very time consuming, but
Yeah.
we are not reimbursed properly, and that's why a lot of people don't like to do psychiatric practice. And if you see almost 40% psychiatrists don't accept insurance, because the work is so intense and so
Yeah.
tedious. It is human relationship. Psychiatry is based on human relationship. It's not that that if you check the blood pressure, you can say medication is working or not working. If patient's depression is getting better and the therapist is good, maybe they don't need medication. So it's very
Yeah,
complex.
maybe.
It's very complex.
Right.
But we don't have fee structure that that is sustainable for the psychiatrist.
Yeah.
And I think that the core problem is the Medicare. Medicare never had good payment system for psychiatrists. So
Right.
they are the trendsetter, and all the insurances follow them. So psychiatrists could never get a
Yeah.
good payment. The surgeons get
No.
good payment. Other especially get good payment except the psychiatry. Those are a lot of psychiatrists do private practice with cash.
Hmm.
So a
I
lot
think
of people who need psychiatric care, mainly in the low socioeconomic group, or people who were middle class or upper middle class due to mental illness, they drifted down, they can get a good psychiatrist.
I think people generally, some people, or maybe Medicare and Medicaid and all that, they think it's elective prescriptions or elective physician visit. And I don't think they understand. Just a little note here, FDA guidance for benzodiazepines specifically state that no single tapering schedule is appropriate for every patient. Just what Dr. Akhter was saying. It recommends an individualized plan with ongoing monitoring and support. Just what Dr. Akhter was explaining. So we are going to take a short commercial break. When we come back, we'll be discussing withdrawal, relapse, clinical monitoring right after the commercial break. Please like, share, and subscribe to keep these shows coming. We'll be right back.
Master of words, powerful player, What life-changing words can Dr. Janet Smith Warfield pull out of her magical toolbox that just might mysteriously open a door you never knew was there? A door to free yourself from fear forever. Transform your rage into right action. Release your guilt. Position you into a life of freedom, purpose, passion, power, and peace. All quite suddenly, unexpectedly, and almost miraculously, with no effort on your part. Join Dr. Janet on Dancing with Words, Dancing with Wisdom, as she and her guests show you how words map our experiences, immersing you in a sound bath that relaxes your muscles, opens your mind, and supports you in co-creating your extraordinary life. Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness, Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals.
Welcome back to Medical Intuitive Insights. I'm Dr. Gloria Warren with Dr. Akhter. Let's move on to segment 3 here. First, let's talk about addiction. This is a huge problem, not just in the United States, but globally. So, Dr. Akhter, what do you say about addiction in the psychiatric field when they come in and they're addicted to something? And what do you think?
I would take a little back. I will take you a
Okay.
little bit back. That why, as the world prospers financially, resource-wise, when the world is united, becomes one due to internet, right? So more prosperity has come. Poor countries also have money, and the developed countries also have. So you see that the incidence of addiction is more in developed countries for few reasons. One of the thing I think is there is a lack of gratification. So the people in the Western world, or like America or Europe, they have everything. They have food, they have water, they have air, they have house, they have car, they have everything. So they don't feel gratified by anything. Then they go to TikTok, Facebook, and then the world is so disconnected, but it's still connected. The kid in the second floor, the older brother in the second floor, doesn't talk to the sister in the ground floor. They text each other. So the it's connected, but it's still disconnected.
They don't know how to socialize,
Yes.
being in person. You'd mentioned COVID, and I just want to slip this in because it just so relates. I'm like, oh, COVID didn't affect me that way because I kept busy and this and that. But I realized, I always said, when they ask me, well, how many people can you speak in front of? I don't know. What do you have? 300, 1,000? You name it. It means nothing to me. Put them all in front of me. It means nothing. And I remember talking to some people one time up on stage, and I was like, wow, I do feel different. I don't like this. And I realized I needed to do things to change that in my mind, being self-efficient, to get it where I can stand up in a audience with 1,000 people in it, not think twice,
Yeah.
But I think it does have a big deal, as well as how you're reared and things of that nature. But I'm sorry, go ahead.
You can say a lot of things on text, but it will be hard for you to say in person. So
Yeah.
there are things, and I think that my brain is rewiring right now. Our brains are rewiring. Our children's brains are rewiring. The whole societal brains are rewiring because of the
Yes.
internet and all these. So we're talking about addiction. So people get addicted because one of the reason is the disconnected world. People have
Mhm.
no society, no social life, plus lack of gratification. So when I was poor, I was in a village. If I have a three times meal, I'm happy. If I have a shelter, I was happy. I was
Yeah.
gratified. When I got a job, I was gratified. When I got my first car, I was gratified. But these are all taken. You have it in America.
Hmm.
So what is gratified? So in Western countries, people have to have a purpose. In
Yeah.
East, getting out of poverty is a purpose. But I think that we see a lot of kids in my hospital. They have, I call it illness prosperity. They have everything. So they feel
Right.
depressed. They don't feel gratified. So we see a lot of people with addiction. And other thing is that alcohol in any way and form has zero, nothing good about alcohol, drinking alcohol. Nothing. If anybody can tell me, I wouldn't agree. Alcohol is bad in every form, every dose, and every stage of life. Okay. But all our social lives hovers around alcohol. So the commonest addiction in our society is alcoholism. Then comes the marijuana. Now
Mm.
it is damaging people greatly right
Yep.
now. Um, there are two studies which that's why the no
DNA.
medical organization supported legalization of marijuana. One is that if somebody has a family history of um, mental illness, smoking marijuana brings it faster.
Hmm.
Second study shows that if somebody has mental illness and if they smoke marijuana, their relapses are more. So that's why. So think about it. There are a lot of kids these days, they smoke marijuana. The people of my age or the boomer generation, they think, oh, we smoke marijuana too. But that's not the marijuana you smoked or I smoked. It is a new marijuana which is genetically
Yeah.
modified. It is strong. It affects the brain more strongly. So
Yeah.
now what happens that one dynamics I see these days in young kids, that first of all they're disconnected. The father, mother, brother, sister, everybody has their iPhones or Samsung and they're looking at it, even eating dinner. So nobody's talking to each other. To connect disconnected people,
Hmm.
and then they are not gratified by anything, and marijuana become legal. So they
Yep.
started smoking marijuana. Smoking marijuana is one of the most important thing it does that takes away all the motivation. So they have no motivation.
Hmm.
So the parents take the kid to the doctor, and the doctor said, "Oh, give some stimulant; they might get better." So they are on Adderall. I see a lot of kids coming smoking marijuana on Adderall become psychotic because both can
Right.
cause psychosis. So incidence of psychosis, I believe, is increasing in younger generation because of the
Hmm.
marijuana and the stimulant, prescription stimulant. And I tell everybody, I'm right, I'm telling in every speech I go, I meet everywhere that like opioid crisis, this is a stimulant crisis. Government has to do something, or the regulator or DEA has to do something to curb the prescription of a stimulant. It is
Yeah.
damaging the society right now in America.
I see
Yeah,
that too.
yeah,
Totally, fully. They
yeah.
actually did a clinical research study, scholarly study at a university, and they found that cannabis actually does alter the DNA. And what was fascinating about this, they found just after like the second or third use, the DNA started to change. There's one particular spot in the DNA strand. So then they checked their offspring and they found that it was damaged, that same spot in their DNA after giving birth to a child. And it
Hmm.
could be the father or the mother that was, smoking cannabis, not when they got pregnant, but in general, the damaged DNA was passed on to the children. And I was like, holy cow. you know,
Yeah.
they don't even broadcast these studies. And I think that's very important. I'll see if I can get that APA reference and put it in the comments for other personal research.
So you know that marijuana was legalized not for medical purposes but financial purposes because the state was making more money of taxes of marijuana.
Yep, a lot of
And
money to be made.
yeah, so this is damaging right now. So these are the two addiction, and then comes the opioid addiction. So
Mhm.
I think the pills are not easily available anymore. Heroin is not available easily, or there is a stigma to use heroin. So some people use fentanyl, and then there is a new thing as I see these days, Creta, which is over the counter in Massachusetts. So you can go to a smoke shop, you can take kratom. So kratom is basically the African tree. The leaves has opium-like effect,
Mm,
and the people are they're eating and drinking those kratom. So they also become an opioid addict. So the
right.
alcohol still is the biggest damage doing to the society, and the most our insurance, the healthcare dollar goes to alcoholism.
Yeah. And, I think there's also political, I don't like to bring up politics, but there's a known political purpose for cannabis being widely used in society. It's the sedation of the masses, is what they call it. And that's what the elite call it. It's a sedation of the masses so that you don't rise up and you seem to be calm as long as you have your cannabis and you can go smoke up every now and then. I mean, this is what I'm seeing too with people. I've learned about that in school and psychiatry, and it's like, boy, it's actually happening in front of us. I think we're all, the society is an experiment. Just like, do you remember they said you could bring service animals on airplanes? People were bringing baby small horses and snakes, and that's their service animal. Now, all of a sudden, they dropped it in 1 week. No more, no more. Just the regular service dogs or one other animal. I forgot what it was. That was, to me, that was a societal experiment on the masses to see on how the public would actually respond to something being given to them and abruptly being taken away. And now I believe cannabis is one of those long-term experiments, same as smoking was for the servicemen in the World War II. They got, the service got paid for how many people were addicted to cigarettes, and then they followed them throughout a lifetime to find out their long-term uh, effects on their human body as well as their mental status. So now they're doing it with cannabis, and I keep telling people, you smoke up that crap, and you know what's going to happen? One day they're going to snap their fingers and say, "We just made it against the law again." And what are you going to do then? And they're like, "Oh, I'll grow it
This
myself."
year, I think this November, it is in the ballot in Massachusetts.
Yeah. Yeah,
Make
they're already put in action for cutting it off from different states now that have had it for the last, like, I don't know, 5 years or so. But yeah, they're starting to want to cut it off. And
yeah,
I wouldn't
well,
want to be addicted to something that I knew that eventually they were just going to snip it off and say, you can't have it anymore. No, thank you. And
yeah.
I want control of my mind. My mind is a gift from God to me. And
Mhm.
I am so grateful. I feel I have a wonderful mind, and I wouldn't want to lose any part of that just to see what it was like or whatever. I can't do that because it's not mine to give. It's not mine to use in that sense.
Yeah.
I'm just borrowing this vessel. So personal. By the way, any of these things that we're discussing today, that is our personal opinion, as well as maybe some expertise. If you're considering cutting down some of your medications, say you're on 13 medications, you think you want to cut down, please don't use this as medical advice. Use this as a suggestion to take back to your medical provider, whoever that is. Okay, that's what we are doing this for. So um, we are going to go take a last commercial break. And when we come back, we'll give Dr. Akhter input on lifestyle support, long-term stability, maybe patient psychiatric partnerships. Stay right there. We'll be right back.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of the Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on the Caring Generation and PamelaDWilson.com.
Master of words, powerful player. What life-changing words can Dr. Janet Smith Warfield pull out of her magical toolbox that just might mysteriously open a door you never knew was there? A door to free yourself from fear forever. Transform your rage into right action. Release your guilt. Position you into a life of freedom, purpose, passion, power, and peace. All quite suddenly, unexpectedly, and almost miraculously, with no effort on your part. Join Dr. Janet on Dancing with Words, Dancing with Wisdom, as she and her guests show you how words map our experiences, immersing you in a sound bath that relaxes your muscles, opens your mind, and supports you in co-creating your extraordinary life.
Welcome back to Medical Intuitive Insights. We're here with Dr. Akhter. You know, if you have a condition or if somebody in your family has one and you have a suggestion for a show title, please place it in the comments. I'd really appreciate that. Now, Dr. Akhter, please continue, and we'll also get into lifestyle support and wherever your heart desires that I think the audience needs to hear about.
So before the break, we were talking about addiction.
Mm-hmm.
So when an individual comes to us who has addiction and has some mental illness, it is very hard to parse out what is what. So
Mm-hmm.
we try to detoxify people from the alcohol or drugs, then look into their mental status, whether it's depression, it's anxiety, it was due to the substances like alcohol or marijuana or cocaine or anything else, or it is a organic illness in the human as somebody is depressed or anxiety. So that makes the things difficult for us if
Yeah.
somebody is addicted to something. So as people stay sober, like I too in my inpatient, I just tell them that while you're inpatient you can smoke, and I'm not going to give you a stimulant. Majority people get better without any medication. So I think that it's very important to people, the prescribers and the patient, to know that not everything you can treat with a pill. Patience cures a lot of things. Good healthy habits does a lot of things. So suppose Dr. Murphy and I, we have a thing that we go in the ocean in winter. And I tell you my experience, then when I come out of this cold water, the feeling I have, the high I get, I don't think I have ever gotten anything. So similarly, I go hiking, and the peace and tranquility I find in the mountains is unbelievable. So I don't need any medication. When you do exercise, eat healthy, you don't need a lot of anti-anxiety medication. And even if you look at orthopedics or look at general medicine, our body is not meant to sit or bed. Body is meant to move. So if you don't move enough, then you have problem with your joints, with your bones, with your muscles, with
You
your
don't
brain.
move it, you lose it.
Yes, yeah.
Yeah.
So lifestyle change is very. In fact, a lot of people, psychiatrists now doing metabolic psychiatry, holistic psychiatry, There is a doctor I saw, she wrote a book about how you can, food you should eat if you have anxiety, you have depression, and so on and so forth. So we can use our life, food and exercise, or society for our cure rather than looking for a pill to cure ourselves. But I think the society has been trained that take a pill and get better, take a pill. Oh, eat as much as you want, take insulin or take metformin. And, that's not the
Hmm.
way the body is meant. So there's another doctor, he treats diabetes without medication. Jason Fung, he has a book. I don't know him, but diabetic code, and he has cured a lot of people without medication. A lot of people, you
Hmm.
can cure yourself with diabetes, just change your food habit.
Right.
Some very minority of the people who have a highly genetic predisposition, they may not be able to do it, but 99% people can cure their diabetes with food and
Hmm. Yeah, no, I fully agree with that. I have people that come to me, and I'm a herbologist as well. So they come to me and I explain to them, well, you need to change the way you eat, and they're having trouble doing that. So I said, you also need to use a little self hypnosis. Like, don't say, I can't have that. Say, I don't want that, because then your brain will understand you just don't want that because of what it does to your body. And then you feel crappy or whatever, and your blood sugar goes up. But if you say, I don't want that, then it's more applicable, and your brain really will begin to believe it as you say it more and more, and then you won't want the foods that you shouldn't be eating, all the carbs and potato chips and french fries and things like that. So and then I add in some of the herbs, and I'll say, okay, you have berberine, you have fenugreek, and you have chromium picolinate, and I would take care of that, and tell them when to take it. Each one's at a different time, according to when you eat and all that good stuff. So Dr. Akhter, it's really the goal to eliminate medication or find the safest level of treatment. This allows the patient to function and thrive in society. Um, do you have a message to give us for the end of our show here?
that, as I said, that some of the serious psychotic illnesses like schizophrenia or bipolar illness, mania, or
Mm-hmm.
some severe depressions, they might need medication. But a lot of things like anxiety, like depression, right? All these you can really take care of with your lifestyle change, your food habits. And my message to our listeners that stay out of taking medication as much as possible. Try find other with alternative ways to treat yourself. Move more, exercise more, swim, go, eat healthy, whole food, vegetarian food, or
Right.
meat is good quality meat, no processed food, anything packed
Whole foods. Yep.
should not be unpacked because they are packed for some reason.
Um, I'm sorry, we're going to have to get to the end here. This program is not intended for, it's only intended for educational purpose. Please like, share, and subscribe. Thank you for joining us. And thank you, Dr. Akhter, for being here, explaining all this. There, but for the grace of God go I. May we never judge another person's journey, but instead offer compassion, understanding, and grace, and support as needed to find safer path forward. We'll see you next time.
Thank you, Gloria. Thanks for
You're
inviting me.
welcome.
Thanks for our listeners. Thank you.
My pleasure.
This has been Medical Intuitive Insights with host Dr. Gloria Warren. Tune in each week as Gloria shares over 40 years of experience and yearns to provide knowledge derived from intuition and research. Wednesdays, 2 p.m. Eastern.